Okay, good afternoon. Thank you all for joining us for today's QC COVID-19 press briefing. My name is Brooke Barnes, and I am with the Scott County Health Department. I'll be facilitating our briefing for today. In addition to our traditional QC COVID-19 update, the Scott and Rock Island County Health Departments will be joined by area pediatricians to provide important information to the public on the need to continue routine vaccinations in order to prevent outbreaks of other types of vaccine-preventable diseases. So thank you for joining us. We will start with our initial COVID-19 update. First, we're going to hear from Janet Hill, Chief Operating Officer from the Rock Island County Health Department on the numbers of cases for Rock Island County. Go ahead, Janet.
Hi, everyone. Thanks for joining us. So today we are reporting 10 new positive cases for a total of 763. We received an earlier question asking us about how many cases are associated with the Tyson meatpacking plant. That number is 194. Our deaths stand at 28. And then regarding the discrepancy of one death reported earlier this week and two within the last hour by the Illinois Department of Public Health, we have reconfirmed the total number of deaths in Rock Island County to be 28. The 3 people the state reported earlier this week already were included in our count, and our total and the state's total now match on IDPH's website.
Thank you, Janet. Next, we'll hear briefly from Ed Rivers with some total numbers for Scott County. Go ahead, Ed.
The number of cases in Scott County today is 399. Our deaths stand at 10, and the number of recovered is 348. You'll recall, since the state is updating its website numerous times a day, these numbers may be slightly different from any numbers you're keeping, depending on the time of day you look. So COVID-19 continues to be in our community and a factor in many decisions that we make until a vaccine is developed or another eventuality that decreases transmissibility occurs. This is a prime example of the need for and the benefit of vaccines to prevent diseases from spreading quickly through our communities. Today, we are joined by the Scott County Health Department's Clinical Services Manager, Roma Taylor, as well as members of our medical community to provide an important message to our community on the importance of continuing vaccinations during this pandemic. Brooke?
Thank you, Ed. As you mentioned, the first person we will hear from today is Roma Taylor, Clinical Services Manager from the Scott County Health Department. Please go ahead, Roma.
So as we wait patiently for a vaccine to be developed to prevent COVID-19 illnesses related to coronavirus, I would like for us as a community to remember that we are currently have approved vaccines that can protect infants, adolescents, and adults from 27 diseases. However, recent data from the state of Iowa reports that stay-at-home and shelter-in-place recommendations, as well as the fear of COVID-19, has caused a decline in well child visits and fewer vaccine doses being given, leaving children at risk for vaccine-preventable diseases. In the state of Iowa, of all non-flu immunizations for people of all ages, we have seen a decrease of 40.4% in the months of March and April of this year from the same time period last year. The month of April experienced the highest decreases in immunizations, with a 35% drop in immunizations given for children under age 2 and a decrease of approximately 75% for adolescents. Vaccines provided to children under the age of 2 protect against illnesses such as pertussis and measles, both highly infectious diseases that spread very rapidly. Vaccines for adolescents provide protection against illnesses such as meningitis, hepatitis, and serious types of pneumonia. I wanted to take a minute to explain why we worry about decreases in immunization levels, even in the short term. As we have seen firsthand with coronavirus, Germs can travel quickly through a community and make a lot of people sick. If enough people get sick, it can lead to an outbreak. Outbreaks are especially dangerous for people who can't get vaccinated. People with serious allergies, a weakened immune system from things such as cancer and other conditions. But when enough people are vaccinated against a certain disease, the germs can't travel as easily from person to person, and the entire community is less likely to get the disease. This is what we call community or herd immunity, and it is very important for those vulnerable individuals. Our community is already vulnerable due to COVID-19. We cannot afford additional outbreaks from measles or pertussis that can make people equally as sick or possibly even die. Thank you.
Thank you very much, Roma. Next, we will hear from Dr. Hayes, a pediatrician with Community Healthcare. Please go ahead, Dr. Hayes.
Okay, thank you. So there's been a lot of interest recently in testing for COVID-19 antibodies to see who may have been exposed to COVID and whether having antibodies means that you have some type of immunity or protection from it in the future. The antibodies that we're looking for with COVID are also important for how our routine vaccines or immunizations work. So vaccines work by protecting us essentially like imitating an infection. When we get a vaccine, we're exposing our body to parts of the infection that cannot make us sick, but do cause our immune system to produce things like antibodies. Antibodies remember the infection, and in the future when we're exposed to it, the real disease in real life, our body uses the antibodies that we have to fight the infection before we ever get sick. At Community Healthcare, we worked very hard to keep our patients and our staff safe from COVID, but at the same time provide the medical care our patients need, like vaccines. We're doing most of our vaccines and our labs and our care outside at this time with lots of space between people and the appropriate protective equipment on. We do have plenty of spots available at CHC for our established patients and for new patients that need to catch up on their routine vaccinations, and even school physicals come this summer.
Thank you so much, Dr. Hayes. We appreciate those messages. Next, we'll hear from Dr. Agrawal, a pediatrician with Unity Point Health Trinity. Please go ahead. Oh, can you hit your unmute button really quickly? Thank you.
I think Roma has done a beautiful job of explaining the importance of vaccination and world child checks, whether it's adolescent or less than 2-year-olds. It's really, really important. We as a pediatrician and parent of young kids also understand there is a lot of fear and anxiety associated with COVID infection. But what the parents have to understand that COVID in pediatric population is largely asymptomatic, and a vaccine preventable diseases in susceptible population can be more deadly and can cause a lot of morbidity and mortality associated with them. So parents should entrust their pediatric caregivers, pediatricians, family practitioners, talk to them, and they can help them out with this. On Unity Point side, we are taking each and every precautions to make sure that parents and patients, they are all safe, and we take precautions. The whole visit mechanism is different now, starting from them getting a call one day prior to the appointment, running through COVID risk exposure questions with parents, making sure the parents mask their children and they are masked too when they come to the appointment. They wait in the parking lot here, and they get a text when their room is ready. Our well visits and sick visits are done in different time slots. The waiting room is different. There is no toys, there is no books, which can be a source of infection. There is safe distancing, the chairs are spaced out, and our caregivers in the office, our nursing staff, everybody is with mask and full face screen to make sure that there is minimal risk of infection spread. So trust your pediatrician, trust your caregivers, call them, talk to them, but make sure you do the well child appointments, get the vaccines done in time, because that's really important.
Thank you very much for that message. Next, we'll hear from Dr. Kukreja, a pediatrician with Genesis Health System. Please go ahead.
Yes, hi. So first of all, as we heard from Roma regarding the numbers, which we started to get a downfall in our vaccination rates in our community-wide or nationwide, it's really disheartening that that whatever mission and any pediatrician across our nation, we truly carry this mission very strongly for vaccination, and it's like 35 to 40% decline means a lot. Over a period of even next few months to years, we can get a big negative impact out of that. At the Genesis Health System, we had made changes right away as we get able to start seeing any first positive case in our QC area. And just to go back in time, and it's in the recent last 2 months, just in about 5 business days of having the first case in QC area, they were set up some mobile collection tents by Genesis Health System, which became operational at the Northwest location in Davenport, as well as Moline Healthplex. And those tent locations did a wonderful job of having the people to go for testing, even if it's a pediatric or an adult, to go through a drive-through location, get tested, and in which the doctor will follow with a test result and further directions while we are taking care of people, making them stay at home and staying safe. As even Dr. Agarwal was mentioning in his clinic, even all locations at Genesis Health Group have kind of did similar safety precautions. And to further enhance all that, all the employees were temperature screened at the start of the day, as well as patients screened right on arrival, not just my patient or a pediatric patient, but their caregiver, limiting the caregiver to one parent. And that change is necessary just because we are trying to do some social distancing. Then with curbside check-in, which was made possible with the efforts from our front desk, as well as nursing staff, that they will go in and check in and do all that check-in in the car and escort the patient right away to the exam room with no waiting room holdup. So just still want to again impart this message as a pediatrician that it's very necessary to keep on coming to regular pediatric visits for yearly or annual physicals, because it gives us the time not just to even do the vaccinations, it's even necessary to track the kids' growth, developmental milestones, and also not to miss on certain things. Just to say an example here, like a bad case of scoliosis, which can go missed if we do not get a chance to see a child over here in the office for a time frame. It's also that we made quite a bit of collaborative efforts, not just my office, but with other pediatricians here across Quad City areas, that we got ourselves prepared, all prepped up, that had it been any pediatric surge in the 0 to 18 year age group, we were all prepared to function collaboratively, as we had come up with 2 locations which we will be admitting patients and having like a designated ward. But thankfully, we were not hit hard in our age group. And in the number of patients which I have tested, there have been a very small number who came back positive in our pediatric population, and none needed to be hospitalized, at least I can say for the patients which I tested.
Thank you very much, Dr. Kukreja. We will hear our last statements from Janet Hill with the Rock Island County Health Department. So Janet, please go ahead with your piece.
Communicable disease tracking is a core public health function, and because of the pandemic, you've gotten a glimpse into the importance of contact tracing and infectious disease monitoring. Normally, our infectious disease staff members spend their time managing more common diseases, such as hepatitis C, strep, influenza, and an unfortunately high number of sexually transmitted diseases, including gonorrhea and chlamydia. Most staff time, however, is spent preventing diseases by giving routine immunizations to children and adults. We rely on the community to get safe and standard immunizations on the schedule outlined by the CDC. When the population is about 95% vaccinated, the risk of getting a preventable disease drops dramatically. This is called herd immunity, as you've heard today. Most vaccine preventable diseases are spread from one person to another. If one person in the community gets an infectious disease, he or she can spread it to others who are not immune. However, a person who is immune to a disease because he or she has been vaccinated cannot get the disease and cannot spread it to others. The more people who are vaccinated, the fewer opportunities a disease has to spread. Vaccines prevent deadly and debilitating diseases. For several generations now, vaccines have been proven to be safe and highly effective. We are hopeful that researchers can find a vaccine for COVID so that our community can gain herd immunity for this disease too. Because of COVID-19, we temporarily halted our immunization clinics here at the Rock Island County Health Department. We are starting to take immunization appointments next week on a limited basis, and we'll be up to our regular capacity on July 1st. To make an appointment, please call 309-793-7080. Children must be up to date on their vaccination to attend school, so getting an appointment before school starts is important. We plan to host walk-in clinics later this summer, and more information will be announced later. Any visit to the Rock Island County Health Department is subject to social distancing requirements, and only one child and one guardian will be allowed in clinical rooms where the vaccination is given. All other children must remain in a vehicle with supervision. All visitors will be required to wear facial coverings. Thank you.
Thank you very much, Janet. We will now go to questions. So for any of our media partners on the call, please type any questions that you have into the chat, and we will connect them to the speakers that we do have on the call. Roma, if we still have you on the call, I was going to have you respond to the first question. Don't the schools require these vaccinations? Can you give us the information we know about the Iowa Department of Public Health's requirements and plans for this school year?
Yes, all schools do require vaccinations, the public and the non-public schools. And just recently, we heard from the Iowa Department of Public Health that they will require children to have all of their vaccinations to attend school this year. So there will not be any delay in vaccinations given. So I encourage all parents to contact their health care providers as soon as possible to get those appointments made, or contact us here at Scott County Health Department.
Janet, have you heard any updates from the Illinois Department of Public Health at this time?
No, we haven't. I do know that the school exclusion date for Illinois is October 15th. So we often have a rush of parents wanting to get their vaccinations in the fall, so the kids can go back to school. So just like Roma said, we encourage people to think ahead and get those appointments made as early as possible.
Thank you. We do have a second question. Please give us examples of the main diseases the routine vaccines prevent. Perhaps we could start with Dr. Hayes for this question. Are you able to describe some of that for us?
Sure, yeah. Like she said, there's 27 that we prevent, but whooping cough is going to be a big one. Measles, mumps, rubella, strep pneumonia, tetanus. Some of those are part of that mandatory vaccine schedule that we're protecting from.
Thank you. We'll give another second for any additional questions. Perhaps one of the other physicians, I don't know if you come into have some of these events happen. Is affordability a barrier, or is it mainly COVID? Why don't we start with Dr. Agrawal first?
I'm not sure I understand the question. With what respect are we talking about affordability? Is it the vaccination?
I think that could possibly be a question, or even of the appointments. Or do you believe that maybe the decline that you're seeing in your clinic there, would that be mostly just due to coronavirus and the nervousness of coming into a clinic setting?
I think majority of this is associated with the nervousness and anxiety and fear around the coronavirus. And I think as pediatric clinics or any pediatric caregiver clinic, all clinics across the board in QC area have been sending out material, talking to the parents, doing Facebook Live, doing things like this we are doing today with the coalition, that educating parents that all the clinics are taking extreme measures to make sure they and their kids are absolutely safe when they come to the clinic. Affordability as such is not a barrier right now. Because Vaccine for Children program makes sure that parents who cannot afford a vaccination or the insurance doesn't cover vaccination completely, they get vaccination through that program. So affordability is not a barrier, the fear is, and hopefully by doing all this, we can overcome this fear around the coronavirus and reduce in vaccination rate. There has been since the March, and going to 4 weeks since the March, there has been reduction of nearly 2 million vaccine orders. So as Roma mentioned, as Dr. Kukreja, Dr. Hayes mentioned, there has been an acute reduction in vaccination rate, and we have to overcome this.
Thank you. And I'm just thinking, since we have you on here in regards to the affordability, Dr. Hayes, would you be able to speak for just a second about the sliding fee scale at community healthcare in case we do have individuals who may find themselves unemployed or without insurance at this point?
Absolutely. I think that's one of our roles here at Community Healthcare is that we will see you, we will see your kid, no matter what your insurance is and whether you have insurance at that time. The sliding scale fee that she's referring to is essentially looking at income and whether or not what you could afford on a payment plan. So we have people ready and willing to talk to you about this at all times. That should never ever be a barrier to come see us for your vaccinations or for any type of medical care.
Thank you. And Roma, would you be able to touch on the Vaccines for Children program here at the Scott County Health Department, and then we can have Janet add anything as well for Rock Island County?
The Vaccine for Children's program here at the Health Department, we offer vaccine to children up to 18 years of age. If their families do not have insurance, health insurance that will pay for those vaccines, we carry the same vaccines that the providers carry. We do think it is important that the children that do have insurance, that they go see their providers because they need those well baby checks, they need those school physicals. But for those families that do not have insurance, we can't see those kids here.
Yes, we have the Vaccines for Children program here at Rock Island County Health Department. We also have an associated pediatric clinic called The Link that can do physicals and do vaccinations, either private or insurance pay or Vaccines for Children. That number is 309-732-0958.
Thank you. We do have one additional question that came in directly to me, and this would most likely be for Roma as well as Janet. Have we seen any outbreaks of common diseases that vaccines control? I'm guessing we could start with anything recently, and then you could go back a little farther perhaps. Or is this more just something we're worried about on the horizon with these vaccination rates declining? So we can start with you, Roma. Thank you.
So we have not been fortunate that we have not had any disease outbreaks actually this year. But we know oftentimes with school starting back, we do see an increase in our pertussis cases. And so that's why we always stress that it's important for children to get their either their DTaP or their DTP vaccine or their Tdap vaccine. We'd like for them to get that before school starts. We have seen a few cases of measles, but that's pretty sporadic. But most often it's pertussis that we see.
I reviewed this is Janet, I reviewed our stats last week and have not seen anything that is not just a case here and there. None of them were measles. And as I mentioned earlier, we still see an unfortunately high number of sexually transmitted diseases. And that's not vaccine preventable, but there is a prevention for it.
It does not appear we have any additional questions from the media. I'll give a moment if any of our speakers have any closing thoughts that they would want to share. If not, we'll go ahead and conclude our briefing.
I just had a comment to make here regarding, since we are worried about our vaccinations rate, and definitely we all know that there are certain diseases which have been vaccine preventable, and we have even been able to eradicate them over worldwide. But at Genesis, we also have during the fall season, Genesis has a flu doses which get given to the elementary school kids all over our Quad City areas, and every year it's to the tune of almost 9,000 doses given out. So there's definitely, we as health system try to do as much as possible. And to the same tune, even for seeing patients for VFC, we do carry those vaccinations, and definitely never is going to be that the affordability should be coming in as a factor in immunizing our pediatric folks.
Okay, well, thank you everyone for joining us for today, and for our speakers for sharing these important messages. And we appreciate the media working with us to get these important messages out to the community. And so we thank you all for participating, and we'll be concluding, but have a nice afternoon as well as a nice weekend. Thank you.